All right, Billy, how about number 9?
Number 9.
We're back to doing cardiac arrest, but now what we're going to do is we're going to do compression-only CPR. We're going to do it in the field. And we're going to do it, not you and I, we're going to take a layperson, so not you. So what this study does is it's a look at data that was collected on basically a compression-only CPR taught to lay rescuers and compared the outcomes to conventional CPR for out-of-hospital cardiac arrest. This is the UCA thing that Billy was talking about. What they wanted to look at was survival to hospital discharge. Now, I have a little bit of a problem with that to start with, although they did kind of sort of fix it later. But they just wanted to know if you got CPR by a bystander in the field who only did compressions, what was your likelihood of survival to leave the hospital compared to somebody who got the mouth-to-mouth and the chest compressions.
And so there are lots of people sort of looking at the big Japanese studies on the hands-only CPR. And we actually, in sort of some of my international work, we're actually looking at training rickshaw drivers.
It might as well.
And putting little CPR stickers on their little rickshaws in India.
They can run right over there, get it done. Absolutely. Now, this is actually data gathered in about a 5-year period in Arizona, and it was gathered because they did an intervention. Basically, they did a thing called the SHARE program. It was a statewide CPR campaign teaching lay people CPR, compression-only CPR. That was it. No mouth-to-mouth, just compression only. And they did it a bazillion ways. You got
editorials, newspaper,
all kinds
videos.
Of stuff. There were free in-person free training, radio spots, you name it. And they estimated that of the 6.4 million Arizonans, 30,000 people got directly trained, and 500,000, a million people, got exposed to the information. So a goodly amount of people were exposed to this SHARE program, Save Hearts in Arizona Registry and Education. The EMS collected the data that went into this study, and what they documented, whether it was compression-only CPR or conventional CPR, and they based it strictly by watching what happened. And they made sure when they gathered the data that it was truly a layperson, that they would talk to the person afterwards and make sure it wasn't a nurse or an EMT who happened to be walking by when this patient went down. So it was truly just Joe on the street when somebody went down and had a cardiac arrest. They had 4,400 of these. Most were men, not surprising. And they were witnessed in about 45%, and lay bystanders did the CPR in a third, and 15% did conventional CPR, and 19% did the compression-only CPR. So it ended up being a pretty good chunk of people.
Yeah, it's certainly a sample large enough to look at.
Absolutely. And the overall survival was about 7%, which is honestly, that's about right. A little bit low, actually, I think, for data that's more recent. But
and some of the videos in terms of, I don't know if you've seen some of the American Heart one and the British. You haven't seen these videos for the chest compression only?
No, I haven't.
Oh my God! There's the guy from Hangover, the Asian actor doing the disco thing with the staying alive
he's an ER
for the
doc,
thing.
I heard. Somebody told me
And
Staying Alive?
and then with Staying Alive. Oh, it's hysterical. And
that's the song, by the way, the compressions. Yeah.
And then the British one is these two dock worker thugs
doing compression only.
Yeah. Oh, it's really.
Oh, I love
really
that. The
funny.
rate thing is hilarious.
They're really funny.
The rate that is either Staying Alive or my favorite though is the same rate is also Another One Bites the Dust. So you can sort of pick whichever outcome you are leaning toward at the time. What they found in this study, let's take it back to the
Although Another
One
Bites the Dust, not so optimistic.
Not so optimistic. No, exactly. Don't sing that in the ER while you're doing CPR if there's family around. Not a good thing. So the bystander CPR, the rates increased definitely. So just overall, a bystander getting involved went up from 28% to 40%.
Which is big.
That's a lot, actually. And then when they did get involved, most of them by 2009 were doing the compression only. They mouth to mouth, not me. And they did 76% of them by 2009. If they were doing it, they were doing compression only CPR. And with it, survival increased. It went from 3.7% in 2005 to almost 10% in 2009. So there was a direct sort of linear correlation with that as far as it going up. What they did is then compared odds of survival. They did these sort of ratios that we're kind of talking about before, but this is actually a little bit more robust than what we're talking as far as using likelihood ratios. So if you compared compression only CPR to no CPR at all, you were basically 1.6 times more likely to survive. If you then
please don't confuse the two. So this is not a likelihood ratio.
No, this is not. This is just your chances of
better.
surviving.
This is actually better.
This is true chances of survival.
Yeah.
Then you took compression only CPR versus conventional CPR. That was about the same. Any CPR actually was pretty good. And then they tried to control for certain variables. They actually went through and tried to control for variables. And they said, okay, if you had a shockable rhythm, if you had bystander CPR when the EMS got, they were doing your compressions, EMS got there, they checked your rhythm was something they could shock. If you got no CPR, basically 17% of those people survived. If you got conventional CPR, it was 17%, but if you got compression-only CPR, it was 33%.
So if those numbers are true, and this is not the only paper that's
No, it's
found
not.
this, it's the best thing since sliced bread.
Oh, it's fantastic. And the theory is based on you do really good CPR is more important than breathing for somebody, and there may be some passive respirations that occur with CPR anyway.
Yep.
That you don't
Chest
break.
recoil brings air.
Yeah,
in.
don't
Yep.
break the rhythm. Just keep pushing on that heart. So they did what you need to do in studies like this is they need to kind of go adjust a few things based on some of the background noise that goes on in these. And they found that the odds adjusted ratio, if you compared conventional CPR to compression only, it was basically you went from a survival rate of about 1.09 likelihood to 1.9. That's a lot. And if it was a shockable rhythm, you basically threefold a chance of actually surviving. It was actually wonderful. Now that's again surviving to get rolled out of the hospital. I would like you to walk out of the hospital. So what they did is they kind of went back and tried to, it wasn't studied up front, but they tried to figure out how many of these people had good neurologic status. So they had to kind of pull things out. And they found that about 4% had good neurologic status, and that it was more likely if you had the compression-only CPR, 7% versus 3% with no CPR and 5% with conventional CPR. So it was better. And then when they did all the odds, the bottom line is any CPR is better than none, and compression-only CPR is better than the conventional CPR.
Yep.
So that's basically what it cuts to the chase. If it was even a non-cardiac cause, you still were better off as far as getting the compression-only CPR. Survival was for any CPR was about the same. So what they said is that the reality is nobody really wants to do mouth-to-mouth on somebody they don't know. People are very reluctant, and it causes errors. Is it 15 and 2, 15 and 1, 5 and 2, 1 and 6?
Even if I know the person, they vomit in my mouth, I'm not happy.
Not good. And people make mistakes. They can't ever remember how many compressions and when they're supposed to blow in the mouth, and it just doesn't. So they said just teach people to push on the chest.
Push hard, push fast is the line.
Exactly,
from
and they're
the
more
video.
likely to do it, and the outcomes will improve. So this study said absolutely does. Okay, you're more likely to do it. They're more likely to do compression only, and your survival rate is better. Odds adjusted ratio overall about 1.6. So it basically says we don't know exactly what teaching people about this that worked.
Don't know which of the tools work because we did the
weren't
whole
sure.
blanket. We did 20 of them.
But the reality is it may even improve neurologic outcome. It looks like a good deal. So basically, significant increase of bystander CPR if they do compression only. They are more likely to do it. You survive better, and there may be better neurologic outcomes. So do it. There you go. Compression only.